Today, we are diving into a powerful shift
Sure.
happening at the intersection of public safety and behavioral health, one that's changing how communities respond to people in crisis. Across the country, law enforcement agencies are being asked to respond to a wide range of calls, many involving people with mental health needs. Traditionally, a 911 call meant a police response. But what happens when an emergency isn't a crime? It's a person in crisis who needs care and not handcuffs. Well, that's exactly what's being reimagined in Waco, Texas. The Waco Police Department, in partnership with the Heart of Texas Behavioral Health Network, has launched a 911 call diversion program that places behavioral health specialists directly into the dispatch process. Now, the goal is straightforward: make sure every call gets the right response at the right time. But how do programs like Waco actually work in real time? And what kind of impact is their program having on both community members and officers on the ground? Hi, I'm Ernie Stevens with the Council of State Government's Justice Center. And to help us unpack all of this, I'm honored to be joined by someone leading this work from the front lines, the Chief of the Waco Police Department. Welcome, Chief Sheryl Victorian.
Thank you. It's an honor to be here.
There's so much I just want to dive into and ask you, but before we do, for our audience who, I don't know how they won't know this, but you have a vast law enforcement background. Could you talk just for a few minutes about your experience in law enforcement?
Yeah, sure. So I have 33 years in the police profession. I spent the first 27 and a half years of my career with the Houston Police Department before retiring as an assistant chief to become the chief of the city of Waco. I rose through the ranks at the Houston Police Department. I worked patrol, gang task force. I worked undercover and major offenders. I worked homicide. I went back to the streets, worked child sexual abuse, worked internal affairs, worked child sexual abuse again as a lieutenant at the training academy, back to the streets, and promoted to assistant chief where I had a third of the city, patrol region 2, until I retired. So yeah.
Amazing. And I have a connection with Houston Police Department. In 2003, they came to San Antonio and first trained the San Antonio Police Department in crisis intervention training. And
Oh,
I'm sure you
wow.
know the names: Frank Webb, Mike Lee. They came out, and
Yes.
Becca and Rebecca. And I tell you what, such an incredible experience to
Yeah.
get that training and to move that work forward. And here we are today, 23 years later, talking about these types of responses. So that's amazing, and thank you for your service. 33 years is just unimaginable. I retired after 27 years, and it was time to go, right? But
Yeah.
another thing I want to ask you before we dive in, the National Association of Women's Law Enforcement Executives, NALI. Like, tell me about that organization and your affiliation with them.
So, the National Association of Women Law Enforcement Executives is an association of women in the police profession, right? And it doesn't matter if you're a sworn police officer or professional staff, it's women getting together to lead, mentor, and inspire. That is our mission, right? I am currently first vice president for the National Association of Women Law Enforcement Executives, and we have an exciting year planned. And yeah, our conference next year is going to be in Nashville, and we have some other things on the agenda. So if anybody's interested, and it's not just for women, it's for women and men, but it's supporting women in policing and trying to help us elevate to the next level, support one another, and to increase representation of female police officers in the profession.
Yeah, I love the organization. I spoke at NALI when it was in Houston a
Oh,
few years
cool.
back on a panel, and it was just a great experience, a great organization. I support them every opportunity I get. So, congratulations on being first vice president of that.
Thank
All
you.
right, you ready for this?
I'm
What's
ready.
the first thing that comes to mind? Let me hear you spit it out. When I say the me I see.
Oh, the me I see. Oh my gosh, just little girls who did not realize they could be the police. And now that they see somebody that looks like them in a police uniform, they realize that it is an attainable goal.
Now, is that a book? Do we know somebody that wrote that book?
Yeah, so I wrote the book. It's called The Me I See. And it was inspired by a young lady when I went to read a book at an elementary school who told me that she didn't know girls could be the police. And then a few months later, I went to a different school in Waco, and a young lady said she didn't realize girls could be chiefs of police. And so I was like, you know what? I'll write a book about it.
I
And so
I love
first
it.
part is done.
I love it.
They realize they can be police officers
My
when that's
goodness,
coming up in
congratulations. Yeah, when I was on the gang unit, Chief, I had 3 partners that were females, and I tell you what, totally invaluable,
Yes.
invaluable. I was very blessed and humbled to have them as partners. So I'm glad you did that. In the book, the cover is very intentional, right? Because if you go and you look at the book, you've got a little girl in a nurse's outfit. You've got one playing a guitar. You got one maybe that's dressed as either a doctor or a teacher, and then you've got an astronaut. So it's almost like if you can dream it, you can
You
be
can
it,
be
right?
absolutely, absolutely. I love how you just
Wow.
explained that cover because that's exactly what my intention was when, we designed that.
Well, fantastic. Well, let's dive into the conversation at hand,
Okay.
shall we? So you all developed your 911 crisis call diversion program in February, I believe, 2024. And since then, you've seen great
Yes.
progress with trained crisis specialists stepping into de-escalation situations over the phone instead of defaulting to police only response. But I'm curious, Chief, what inspired the creation of it in Waco, and what did it take to get it up and running?
So that's a great question, and thank you so much. But as I started promoting in policing and maturing actually in policing, my perspective of how we handle these types of calls began to change. Initially, the rhetoric was, that's not our responsibility, it's not our responsibility. But what we found was that we always got the calls. And so when I became a chief, I was like, you know what? If we can't be, we got to stop whining about it. We need to join forces with those that are able to handle, and we need to work as a team in order to address the needs because we're going to continue to get the calls, right? So we were at an event the year before in 2023, and they asked us to give a wish list. And I threw out on my wish list, I said, you know what? I wish that we had partners that could respond to our behavioral health calls so that we don't have to send a police officer out. And I think God heard my prayer. But the
Mm.
next in a few months, the next thing you know, Behavioral Health Network was calling and saying, "Hey, we have funds for a program, and we'd like to talk about it." And that's how it came about. And we were all on board, got everybody trained up, started with one shift, and it has just been a real blessing for our community.
Yeah, when I talk to people and they ask, how do we start a program? Like, how do we find funding for it? They're trying to solve all the problems before even defining what the issue is. It's almost like, well, start locally, find an issue, bring together a small group of stakeholders, pilot a program, and then have it evaluated to find out, are these programs, can they be sustainable and what kind of effect are they having on the
Yeah.
community? So it sounds like you really followed suit with that and were very successful. So my next question would be like walk us through what happens when a mental health related 911 call comes in, and then how do you decide whether a call is diverted from police to a crisis specialist?
Okay, so when a mental health related call comes in, our dispatch team, they do what dispatchers do, always do, right? They assess the safety, the urgency of it, and then the nature of the call. And if the information indicates that this may be a behavioral health crisis rather than a criminal call, then the call will be routed to one of our coordinators, a crisis specialist that's embedded in our dispatch center. And then that specialist will begin engaging with the caller, helping assess the situation, de escalating emotions, and determining what type of response is appropriate. And in some cases, the crisis can be stabilized over the phone. And in other cases, the person may need a behavioral health response or follow up services. And if at any point there's any indication of danger, violence, weapons, or an immediate threat to that individual or somebody else, we still send a police officer. But it's not about removing safety from the equation. It's about adding the expertise and the needed experience for the person that's on that call.
Yeah, I love that, right? You're not removing the element of safety, but you're adding the element of well-being, I think is as a holistic approach to that. And now, if I'm not mistaken, Harris County, like you're from Houston, Harris County has a program like that,
Yeah.
where they embed, right? Where they embed dispatchers and we're seeing that as a trend. I wish more agencies were able to do it, but workforce and staffing is such a difficult barrier to overcome so I'm sure you're gonna have a lot of people reach out to you after this and be like, how did you do it? Right. But let's try to answer some of those
Yeah.
questions. I'm assuming that you watch some of these calls or listen to some of these calls come in when this program first started. And I'm curious, what techniques have you seen to be most effective for de-escalating someone in crisis over the phone?
So it's determined by risk, right? Risk, safety, and the nature of the call. And if it appears to be a behavioral health call without an immediate public safety threat, then that's when the diversion comes in, right? If there are weapons, active violence, credible threats, or anything suggesting that somebody is in danger, we'll still dispatch an officer. The key is just not simply, is this a behavioral health call? The real question is, what is the safest and most appropriate way to respond to the specific moment and the person and their specific need, right? So it's important that our dispatchers and crisis professionals work very closely to make that determination. The goal primarily is to avoid sending a police only response to situations that are better addressed by people who are trained to handle people in crisis, and while at the same time not compromising public safety.
Yeah, and I love how you put that, right? Because we want the right response to the right call with the right outcome. And, in my mind, I'm thinking, wow, that's how do you triage that so carefully over the phone? Because what may come in as a mental health crisis could actually be a substance use issue or some other type of social determinant of health issue that needs to be addressed. So there has to be, this middle ground of, how do we determine what needs a response and what needs a referral? So speaking of that, when someone is stabilized on this call, how do they get connected to ongoing care and community resources?
So we have a wonderful program that started before the Crisis Call Diversion Center. And I say it's a program. There's actually one young lady who is just incredible. And her role is our social resource coordinator. And initially she came over on a pilot program with another local organization. And she was doing such great work and helping to impact the number of times we come in contact with some individuals in crisis that the city allowed us to hire full time. So our social resource coordinator and crisis specialist is in place to help navigate individuals or calls that we've responded to where individuals may need that long-term care, right? Those wraparound services. Our social resource coordinator is critical because she plays a part in the stabilization of that individual, right? And to reduce the number of times that we actually come in contact with that person. Long term success, it depends on that connection that is made afterwards, that connection with the individual, that connection with the family, and making sure that we're connecting people to treatment, follow up care, housing, support, medication resources, case management, or any other community based services that they may need. She's just incredible. So we, in addition to that crisis call diversion center, that role of that social resource coordinator who was already in place and already doing similar work as opposed, she wasn't answering the calls, but she was responding as follow up to provide wraparound services, are now just working so well together.
And what level clinician are you utilizing in this dispatch process? Is this a licensed clinical social worker? Is this a 4-year bachelor level care clinician?
Licensed social worker.
A licensed social
Mhm.
worker. Wow. Okay. And yeah, that is the difficult part is trying to find qualified individuals, especially in the world of social work. I think for so long, law enforcement didn't understand the importance of what part social services play in the day-to-day work that we do, right? When I was responding on a multidisciplinary team in San Antonio, yeah, I did very little, chief. All I had to do was make sure that the scene was safe, and then I had to get out of the way and let the clinician do the work. And when that happened, the outcomes were more favorable. You mentioned, you led on to the fact about high utilizers. How do we get individuals to not need to call? Because I would assume if you're an individual living with a mental health diagnosis, you really don't want the police in your day-to-day
Absolutely.
business, right? So, you know, finding out where's the need, where's the gap, how do we lower the acuity of these individuals that seem to call on the day-to-day basis? And what I heard you say was is the continuity of care. is that back end to make sure that we're meeting their need where they are and then providing the resources that they
Right.
need.
And that requires partnerships throughout our community, right? Whether it's courts or social service organizations. So we're very, very fortunate here in Waco to be able to address this population and see a reduction in the amount of times we come in contact with them.
You know, you mentioned the courts. Like a lot of people don't think about that process and what does law enforcement, what does social services, how do they interact with the courts on somebody that has a mental health diagnosis and maybe they are have a pending charge and there's a component of mental health to the reason that they are in the criminal justice system. You know, what can we do to mitigate that individual from having to be incarcerated if they don't need to? And we can provide services. So there's a lot of collaboration that has to take place, a lot of people sharing the same vision. And there has to be champions in each of these organizations to really see it
Right.
through. I mean, that's what I've seen work really well in the past is we've had a champion judge from Bexar County that says, I want to do diversion in my court. We've had champions in law enforcement and the fire department saying, yes, we want to address our high utilizers and keep them out of, from having 911 respond. And then we've had champions in the hospital systems and the private treatment providers saying, well, what can we do to help get services out in the field so, we're not
Right.
overrun? Because it's when you come across somebody that's a high utilizer of services, it can really tax your services. So I love the fact that you mentioned the continuity of care and the wraparound services. So now that this program's been going for a few years, I'm curious, for law enforcement, like what changes have you seen so far as outcomes, not only for the individuals, but for law enforcement resources?
So the early impact has been very encouraging, right? In 2025, dispatch diversion program um, diverted 1,303 calls, right, with a mix of police response. That's a police response, combined response, and then non-police response, right? That tells us two important things. One, the program is being actively used, and then two, not every behavioral health related call requires the same type of response. So we're learning, right, as we're going. But from a public safety standpoint, the benefit is that officers can remain focused on calls where police action is truly needed. Right. While individuals in a crisis can be connected more quickly to the type of care that may help them most. Community behavioral health presentations tied to this work also emphasize the reduced strain on our police officers and our police resources, improve crisis response for those that are in need, and fewer unnecessary justice system and emergency room impacts.
So I'm curious, right? Because right now, the default phone number, it seems like for somebody in a mental health crisis, if they're not familiar with 988, right, will be 911. So when they call 911, I'm assuming that they're expecting to speak to an officer or have an officer show up. So what are people's responses when they find out that they have an opportunity to speak to a clinician instead of having an officer respond?
I think once they realize that they are talking to somebody who may understand their needs, who help them to de-escalate
Mm.
the situation quickly, that they're more receptive and more trusting of the process. Because a lot of times if somebody shows up in uniform, we refer to ourselves as law enforcement officers for so long, they think that we're there to enforce the law, right? To take away their freedom. But I feel like social work, behavioral health specialists have the training and the understanding in how to handle those particular calls. And I think it's recognized really quickly by those people who may be in crisis. And it helps to build that trust to get them the help that they need as soon as we can.
Yeah, I think trust, through rapport and empathy is is something that has to be earned, right? You can't show up in uniform and expect it to be given, right? Because I would actually say I think it's a fair statement that if you're a person living in this country with a mental health diagnosis, you could have been mistreated at some point by law enforcement. I think that's a fair statement, and I say that based on my experience as a law enforcement officer and what I have seen. So I love that there are options now, whether they're being connected with a clinician or now, having options to call 988 just adds another level of
Mm.
care that wasn't there
Yeah.
before. Chief, what was the biggest challenge in building this program?
Ooh, so I think the biggest challenge in building a program like this is building a true cross system response instead of just
Mm.
adding a new component, right? And saying, hey, okay, this is going to solve the problem. No, there's a lot of work that needs to be done in preparation for a program like this, right? It requires trust between our dispatcher, our officers, our clinicians, our Heart of Texas Behavioral Health Network partners, and our other community partners, right? We have to identify what those shared protocols are going to be, the training, the staff, getting a clear understanding of when to divert, when to co-respond, and when the police are not needed in those situations at all. There's also a practical side. The practical side include staffing, making sure that we have the appropriate people to staff. What hours are we going to cover dispatch or crisis call diversion program, and making sure that the model can function in real time in dispatch conditions, right? And I think that that relationship and that bond formed really quickly because we started off with just a few people who understood the process and what we were trying to do, and we were on the same page. We had the same goals, and so they were able to make adjustments as needed. But yeah, those were some of the challenges.
Yeah, I remember it was probably 3, 4 years ago when I first started here at the Justice Center that I was sent out to Denver Police Department, and I got to meet Chief Payson out there, and we had convened a group of high level leaders to go and listen to how they did their Denver Star program and their co-response, and Waco PD was there, and this was one of those opportunities that you didn't let slip through your fingers. So many times people go to a conference and they get information and then they don't do anything with it. But it just seemed like that particular visit and what you gleaned from Denver, you kind of brought back and had this vision of me based on your community's needs. And you built that system out, and everybody was like minded in how they wanted to do that. So it really came to fruition to see groups of people come together, but then go back and do something with it. And, I applaud you, Chief, for doing, I mean, you were probably just getting started there as the chief in Waco, because I remember you going over there and I was so excited for you, and to hear that you immediately made this one of your
Yes.
priorities. And it's leadership like yours that sets the tone for the next generation. And I think that's so important that you have provided that. You have provided um, a great way to represent women in law enforcement and leadership. You just continue to shine. So as we get ready to wrap up, I'm curious for what advice would you give other communities looking to implement a similar
So
model?
one of the things that I would say is to start with the partnerships that you have and make sure that there's clarity of mission. Understand what we would like the end goals to be and allow people to give their input so we can have that buy-in and essentially make sure that we're meeting the needs of those in our community who are experiencing crisis, right? We can't do this by ourselves in policing, and behavioral health providers cannot do it by themselves either. We figured that out,
Yeah.
right? So we need a shared commitment to public safety, a humane response, right? And a long-term system connection and those relationships. And then second, we need to build clear decision points. Everyone involved needs to understand what's going to get diverted, right? What's going to get co-responded to, and what's still going to require that response. And third, invest in infrastructure, not just intention. That means training, data tracking, communication protocols, and that strong commitment to the behavioral health of our community and those that are in need. And I would say finally, just stay focused on the outcomes, right? And be willing to pivot if you need to pivot.
Yeah, well, I think that is great. That is great advice, because I think defining roles and defining just having a shared language is so difficult when law enforcement begins to have this marriage with behavioral health, because it's like learning a new language. And I remember how difficult that was, and wondering, why do you ask these questions on calls, and I don't understand. And then get to listen to the clinicians do their assessments and listen to the doctor give their feedback, and it was such a learning experience. And then I understood, you know, law enforcement, like wearing a badge is so much bigger than responding to just calls and trying to solve crime. It truly is a servant mentality of going out and giving yourself to somebody in need, but doing it in a way that you can provide the best possible resources. And in looking at your program and what you're doing there, just like what's next? Like what's next for Chief Cheryl Victorian? Like tell us, like one, what do you have any future projects that you're working on that we can keep an eye on? And number two, if people wanted to reach out to you, how can they get a hold
Sure.
of you?
So, number one, we are in the process of starting a multidisciplinary response team. So, we're
Oh,
just going to have the full circle of the needs for our community. I can't wait to get that program started. Our social resource coordinator right now is going to be our program manager. And when you talked about that shared language, and I smiled in my heart because I thought, man, once she ingrained herself in our organization, that kind of bridged that gap with that shared language for the police to get a better understanding, right? And then for her to be able to articulate to those in her field our language and get us on the same page. So that's been incredible. But we are starting an MDRT program. We are in the process of doing that right now. And hopefully by August, late summer, we'll have that program up and running. We're working again with our Heart of Texas Behavioral Health Network team, as well as Waco Fire, and we're excited to get that program up and running.
I would be so excited too. I was part of the
Oh, wow.
multidisciplinary team, and I had a paramedic from San Antonio Fire and a clinician from our local mental health authority. And you talk about bringing a full array of services to an individual. Because there's so much need that people just don't have access to, when it comes to care, whether it's a primary care physician, whether it's housing, whether it's a benefits specialist. And that type of approach, I truly believe is a gold
I
standard. So congratulations on
thank
that.
you.
And more importantly, how do people get a hold of you if they want to ask you some more
So my
questions?
email address is Sheryl, SHERYLV at wacotx.gov. Also on LinkedIn at as Sheryl Victorian. So not that hard to find, but yeah, somebody can email me if they would like to talk to me. And my phone number is 254-750-7502. And I'd be happy to answer any questions or to direct calls for people with answers if I don't have them.
Well, Chief, thank you. I know your time is precious. I want to thank you for your time this morning. I want to encourage everybody that's listening to this, go to Amazon and go look at the Me I See. Get you a copy for yourself. Give it out as a gift, stocking stuffers, whatever, however you want to do it. Do it. Beautiful book written by a beautiful person with a beautiful heart, and I can't wait for you to work on your next project. And thank you for spending some time with us today and letting the audience know a little bit what's going on in Waco,
Yes, sir.
Texas.
It's my pleasure. Thank you for having me.
Thank you, Chief.